I think that's a key tenet of our profession, is to treat every patient, every human as an equal, and that's what we do. So we're going back before the 1930s. African American people, particularly North America, were, subject to a lot of violence, a lack of basic rights, and this term wokeism first appeared to describe social justice, particularly from that racial point of view. And then again, it sort of resurfaced in the 1970s, again during the civil rights movement in North America. But again, recently, since the death of Floyd, and then the more recent Black Lives Movement. So, although the original term was used to describe social justice with a particular view to race issues, it's now been taken to determine anything which is sort of left wing, modern, progressive, liberal.
So what I'm getting at here is that the term has been removed from its original historical sort of grounding in social justice. So why would you think that's the case?
Depending on sort of what the societal issues at that time were, it's been sort of rebranded a little bit. So it's now certainly a far more encompassing term than it was when it was first coined. But on the other hand, those critics of wokeism, particularly on the right and the far right, use it as a disparaging term against all sorts of liberal and progressive viewpoints, be that race issues, be that social issues, be that feminism, be that, promoting equality. So both sides have sort of taken on a slightly different meaning than how it was first set out, but it also has meant that it's more open to abuse. People are finding it increasingly difficult or unwilling to learn about someone's opposing viewpoint and meet somewhere in the middle. If you say something that someone doesn't like, we say it as a joke, but you get cancelled, and that means we may very well destroy your life. And we've seen examples of this on social media, where certain celebrities, or even the case of a doctor who said something a little bit controversial, well-intentioned, but was subject to a great deal of abuse online. And it's because we are kind of fixed in our way, fixed in our thinking, and are unwilling to learn a different point of view.
It was written in the New York Times as well that it becomes something like a paper tiger where different companies might embrace the identity or embrace the inclusion so that they can expand their market share. But then at the end of the day, might not actually change what's beneath it or what's causing these issues at first. And so, what if nothing's being done about it? What will happen?
You got to look at, why are fewer ethnic minorities entering professional degrees in the first place? Why are less working class white people getting to university in the first place? And until you sort out those social inequalities, which have persisted for decade after decade, you're not going to resolve the problem. You need role models. You need people who are in these positions of power who can institute change to try to improve the chances of those underrepresented communities of working class people to move through the system.
Do you think the same divide is happening in medicine and surgery?
As a profession, we are dynamic, we are adaptable. And so you wouldn't perhaps speak in the same way to a patient who was 20 as you would to a patient who was 80. They're from different generations, and we're quite well versed in how to approach patients as individuals. But I do think you need to have that within your armory to adapt your communication style, the way you manage patients, treat them, the way you explain things to them, and the way you overall interact with them, in order to ensure that you treat them as an individual, irrespective of their age or background. But nonetheless, within the profession itself, yeah, listen, is there racism in medicine? Of course there is. Is there sexism? Of course there is. Is there favoritism? Of course there is. These things happen. They might have got better over the years, but it still occurs. I just think that because we haven't personally encountered them or witnessed them or spoken to someone who may have been a victim of them, we just assume that they're not common. But if you look at the Royal College of Surgeons report into women in surgery, it's absolutely horrific, the findings. Well over 50% of female trainees in surgery have experienced some sort of sexism, discrimination at the workplace. So I think it is a problem. I think the difficulty is as individuals, because we haven't personally encountered it, we're sort of quite oblivious to it. So that's why I think it's important for these studies to happen into these societies which affect wider society within our profession. And it's incumbent on us to understand them and learn about them so that when we do eventually encounter it, if we do, we're in a position to call it out.